Hello, I am Dr. Murli Mohan. I work at the Narayana Medical Bangalore in the Department of Sleep Medicine, Pulmonology and Internal Medicine. So sleep is one of the most important drives, as important to drive as hunger, as the need to have sex. And unfortunately, this is not realized by any of the groups concerned with health. Government does not recognize it. We don't have adequate sleep laboratories. We don't have adequate departments of sleep medicine. Corporates don't recognize it. Corporates should be interested in the sleep health and sleep hygiene of the people who work with them. And by and large, populations do not recognize the importance of sleep, while we all place tremendous importance on food, on hunger, and solving these problems. But we must remember that sleep is as important to drive as any of these and needs to be addressed by all these groups. Insurance companies do not provide adequate care of patients who need their sleep problems investigated. So we don't get coverage of, for example, polysomnography or sleep studies. We don't get coverage of the machines that are used for the treatment of sleep apnea. And we don't have coverage, for example, of a problem like insomnia. So I think all of us need to wake up, as it were, and look at the importance of sleep. So as I already mentioned, we don't have adequate recognition of this as a problem, and we don't have adequate coverage of these aspects as an issue of sleep, as sleep being a health-related issue. So for example, I'd like our government to wake up and say we need more sleep departments. I'd like the government regulatory authorities to wake up and see that sleep is a huge problem when it comes to road traffic accidents. It's probably not well known that road traffic accidents are a major cause of injury in this country, and at least 10% of road traffic accidents in the United States are related to sleep disorders, or sleep disordered breathing. So that's something we need to wake up. We give licenses to people who have sleep apnea, and when you think of these people driving through the night, especially in heavy traffic, large heavy goods vehicles, and they can cause a tremendous amount of damage. We do not necessarily have licensing of pilots, for example, who may have sleep apnea, and that can be pretty dangerous. So we need, first of all, the regulatory authorities to wake up and say, yes, there is an important area that we need to look at, because sleep apnea, for example, affects something like between 4 and 20% of the population, going more common as people grow older. So we need the regulatory aspect of it to be looked at. The second is the insurance companies. Insurance companies need to wake up and say this is one aspect that affects all areas of health. So for example, it affects diabetes, it increases the risk of heart attacks and strokes, it increases the risk of heart failure, rhythm disturbances. All these areas, which independently are covered by insurance, are not going to be seriously improved unless you go back to the core association, which is sleep medicine. So they need to bring sleep medicine into their ambit, and the coverage of sleep-related problems, including the diagnosis and the treatment. So there are various challenges that we face in the management of sleep-related problems. Yeah, so one of the most important problems is that there is inadequate recognition of sleep, both sleep hygiene and sleep health on the one hand, and sleep-related disorders, including sleep disordered breathing, not just among patients, not just among the general population, but also among doctors. Every time I give a talk on sleep apnea, for example, I start off by asking doctors if they have any of these symptoms, ask them to put up their hands, and you'd be surprised how many doctors themselves have sleep apnea. I have sleep apnea and I didn't recognize it for a long time, though I'm a sleep specialist myself. So this is an area that we need to improve awareness of, what is health related to sleep or sleep hygiene, and what are the disorders of sleep, including sleep-related breathing or sleep disordered breathing. And this is not only among the general population, but also among the medical community itself. Awareness needs to be increased, and that's a huge challenge still. So I work at the Narayana Medical Bangalore, and we run a department of sleep medicine within the Department of Pulmonology and Internal Medicine. We have at least 4 or 5 of us who are passionate about sleep. We run 3 sleep laboratories, which includes level 1 polysomnography, which is the most detailed form of sleep study for sleep-related breathing disorders. We run a close relationship with our psychiatrists who look after the insomnia part of it and the parasomnias and the dysomnias apart from the sleep disordered breathing. So we have a very extensive area devoted to sleep, and we hope to increase this as time goes on because we are unable to match the demand for sleep studies. So those are the main things. We work together with a lot of our partners in business who both offer sleep studies at home when patients are unable to get it done at hospitals. And we also offer the care that people need once they are diagnosed with sleep disordered breathing. So yes, we plan to expand on this area more and more because it is an extremely important area, and that's something that we are coming to realize only more recently. So sleep medicine has really evolved properly over the last 15 to 20 years. We previously had a clear idea that sleep was important for health, but we did not recognize these important areas of sleep disordered breathing, obstructive sleep apnea, central sleep apneas, and so on. And even more recently, in the last 20 years, perhaps we've realized the impact that this has on physical health. We first of all learned how to investigate for sleep-related breathing disorders. So we've moved from the more basic forms of sleep study to the more advanced forms of sleep study, which has really helped us to understand what is happening during sleep. More recently, we're applying molecular diagnostics and advanced imaging techniques. So one of the things that has appeared just in the last 2 or 3 years is the importance of sleep in literally cleaning the brain. So the brain cells get cleaned during phases of REM sleep, and inadequate REM sleep leads to a greater chance of developing Alzheimer's disease and other dementias. And of course, the problems that you get with lack of sleep and sleep disordered breathing also leads to a greater risk of strokes, multiple mini strokes that leads to vascular dementias. So we've realized the importance that it's not just to have a good night's sleep and function well the next day, it's also to clean the brain for the future. So that's one area that is progressed a lot over the last few years. The other is in the area of therapeutics. Apart from recognizing the problems that excessive medications can do, which just promote sleep but not healthy sleep, we've realized that there are other things that can be done with medical advances. And 2 of the areas that we have found is, one is in the area of CPAP and BiPAP machines, which help to prevent sleep disordered breathing and which make a really big difference to improving the quality of sleep and reducing the health-related problems associated with sleep disordered breathing. The other is recognizing the role that implantable devices can make, and these are now being licensed by the FDA, where you have something which takes care of obstructive sleep apnea and of central sleep apnea and works like a pacemaker. So these are 2 very important areas of diagnostics and areas of therapy of sleep disordered breathing that I'm excited to see improving over the next few years.